From the Gulf States Newsroom, this is the Gulf States Gumbo, your weekly serving of stories from Alabama, Mississippi, and Louisiana. I'm community engagement reporter Elise Gregg, chopping it up this week. On today's show, there's a saying in the addiction recovery space: you can't recover from drug addiction if you're dead. And that's really the whole idea behind the approach called harm reduction. Keep people alive so when they're ready, they can seek treatment. The Netherlands is often considered one of the first countries to really embrace harm reduction policies, and it helped end the country's heroin crisis a few decades ago. Our public health reporter, Drew Hawkins, actually went to the Netherlands back in March with a fellowship sponsored by the Association of Healthcare Journalists and supported by the Commonwealth Fund. And he joins me now to talk about what he saw and what the Gulf South could learn from the Dutch approach. Hi, Drew.
Hi, Elise.
So I'm a little newer to this newsroom, but I think we had an episode on this before, right?
We did indeed. Back in July, we had an episode called "The Dutch Solved Their Opioid Crisis. Can Their Approach Work in the Gulf South?" And it really looked at policing differences and harm reduction, which you just described, but looking at it as sort of a broad concept. So if you haven't heard that one, I highly recommend people to go check it out.
Yeah, absolutely. But you're here to talk about a specific program, right? I mean, since that episode came out, there's been a lot of big political changes and funding cuts. And I mean, the Dutch government did collapse. It's been a bit of a year.
Yeah, I would say that, the U.S. does not have a monopoly on having a year, for sure. But you're right. And I wanted to zoom in on a specific program in the Dutch system for this episode. And to do that, I really need to start by telling you a story. It's about a woman named Michelle in Birmingham, Alabama. Michelle had a really hard life. She used a wheelchair, she'd had a leg amputated, and only one of her arms worked after she suffered a stroke. She was sleeping in a park in Birmingham, and she'd recently been hit by a car when Danny Sims first met her at a warming station on a freezing winter night.
And she told me she loved me when I went that time. She'd asked me to go get her something from the store, and I did. And when I came back, it was like she was almost surprised that someone would do what they had said they would.
Danny Sims works with Recovery Resource Center in Birmingham, and she helps people living on the street navigate the city's substance use treatment services. And she'd been working to find long-term care for Michelle, but nursing homes turned her away because she couldn't manage her daily needs and because she used drugs.
The world had failed her, and she was really set on, there's nowhere for someone like me to go.
So Sims is trying to find somewhere for Michelle, and because she works closely with the homeless community in Birmingham, she sort of had her ear to the ground with the city's drug supply. She knew what drugs were being used, what kind, what the quality was, that sort of thing.
Wow. I mean, that does make sense, though. I imagine there's a lot of trust that she's earned, and she's just there to help. So folks would be pretty open with her about things, what they're struggling with and if they need help.
That's exactly what it's like. That's, why it's so important to cultivate that trust with the community she works with. These are some of the most vulnerable people, right? And if there are drugs in the market that are hurting people, they would let her know about it. And that's exactly what happened in July this year, when a toxic batch of dark-colored methamphetamine appeared in Birmingham.
I found out about the bad meth batch that Saturday.
After she heard 2 people had died after using the brown meth, as they called it, Sims tried alerting other people. But in Alabama, there's no official system to test potentially toxic drug samples or warn the public about them. So she had to do it on her own. She reshared a social media post, contacted the health department and the coroner's office, and she went looking for people she was worried about, including Michelle. She went to the park where Michelle would often sleep. She asked her friends about her, but she couldn't find her. And then she got another call.
And then they found her the next morning. She was deceased, which means she had been struggling with this intense pain, like according to the other people who had used it, for hours by herself and unable to wheel herself away or call for help.
That just sounds horrible. I mean, do we know what happened, what caused it, and how many other people might have been hurt?
Yeah, so I talked to the Jefferson County Coroner's Office. They told me at least 5 people, including Michelle, died after using the brown meth from a toxic mixture of fentanyl, fluorofentanyl, and meth between June and July this year. And also in their system were cutting agents like lidocaine or quinine, which could have given the drugs that dark color that people knew it by, and it also could have made it extremely painful to use it. But the thing is, aside from Danny Sims sharing a social media post, trying to contact the health department, doing her best to put the word out, there was no official warning put out about this deadly batch of drugs.
That's just awful. I mean, that it's horrible that there wasn't a way for her to have seen Sim's social media post or some other more widespread warning about brown meth and the risks and the painfulness of it.
Exactly, Elise. What you're describing is called drug checking. And what it is this service that tests and analyzes drugs, and it tells people what's in them. And this is a program that is a big part of the system in the Netherlands. If Michelle had been in the Netherlands, she would have had access to drug checking services. And the brown meth could have been analyzed in a lab like the one I went to in the Dutch city of Utrecht called Trimbos Institute.
So, this is full of drugs.
That's Don Vanderhouwe showing me around. He's a lead researcher at Trimbos, and in the lab, he shows me a locker full of samples sent in for testing. They're these neatly labeled plastic bags. Some of them are containing brightly colored pills, and others are holding small tubes of powder.
It might actually be nitazines, for instance, or fentanyl, but probably it is cocaine. And probably somebody has used it and said, well, I didn't feel well afterward.
Oh, wow. Okay. So it sounds like drug checking is sort of just a normal part of their system. What are the logistics there?
Yeah, exactly. So drug checking is funded by the Dutch government. And this system, it's saved lives. And the way it works is simple. People can send in samples anonymously if they want to, and a lab like the one at Trimbos Institute will test it and send them the results. But a really big part of this is if a dangerous batch is found, it triggers this nationwide red alert. And it goes out within 24 hours. It runs on television, radio, newspapers, and on social media.
Okay, so instead of someone like Danny Sims in Birmingham having to try to spread the word by themselves, there's like a national PSA campaign that goes out when deadly drugs are detected.
It only triggers this red alert if there's a toxic element there. Like, for example, a few years ago, there was a batch of ecstasy pills, and they had the Superman logo on them. But they were toxic. They were dangerous. Trimbos Institute detected it and put out a red alert, and nobody in the Netherlands died from using or taking these pills. But in the UK, which at the time didn't have a national drug checking program, at least 5 people died from the same pills.
Okay, interesting. And how long have the Dutch been doing this? Like, has this just always been a part of their system?
Actually, no. I mean, the Dutch have this kind of reputation of being especially tolerant of drug use, but there was a time where things like harm reduction and drug checking, they were not supported at all. In the 1980s and 90s, there was a really bad heroin epidemic in the country. And at the time, Dutch activists were trying to change the country's approach. One of the biggest ones was a guy named August Delors in Amsterdam, and he argued for what he calls a third way.
The first way was police, criminalize the user. The second was the clinics. The third way was accept the use of drugs, accept the risks, don't turn away from it, but minimize the risk.
So Delors started doing harm reduction at parties, everything from first aid to on-site drug checking. By 1992, the Dutch government had gotten on board, and they created the National Drug Checking Program to coordinate warnings, like with that red alert system I was talking about.
Okay, so the Dutch government got on board, started funding things like drug checking, and they've been doing it ever since?
Essentially, yes, but there's still been some pushback to this. In 2002, Dutch lawmakers banned on-site festival testing, so at like big, large music festivals. Their concern was that it would legitimize drug use, which is something you'll hear a lot of officials here in the U.S. say. And that's when drug checking became this office-based system where samples are dropped off for lab testing at places like the Trimbos Institute. And in recent years, there's been a growing movement against things like harm reduction. So to learn more about this, I went to The Hague, which is where the Dutch parliament is, to talk to some Dutch politicians like Joost Sneller, who's with the liberal D66 party.
Traditionally, we've had a history of harm reduction focused policy, but in the last couple of years, a focus on repression has been taking and getting the overhand.
So that shift in focus that Sneller is talking about, he's really referring to a rise in far-right politicians. And the biggest one for sure is a guy named Geert Wilders. And he uses a lot of the same nationalist, anti-immigrant rhetoric that you'll hear here from our president. And here he is talking to the press ahead of a national election.
And the elections, for sure, are historical. It's a choice that the people of Holland can make on March 15 whether to give their country away more and more or to get the country back to themselves, to make the Netherlands ours again.
That's sounding a little bit like the Dutch version of Make America Great Again.
You know, it's funny, like he's actually often called the Dutch Donald Trump. I mean, if you look at a picture of him, they may use the same hairstylist. It's actually pretty striking.
Yeah, I'm looking at a picture of him now, and he and President Trump are twinning just a little bit.
Yeah, a little bit. But, you know, Wilders did get elected. He became the prime minister, and he pushed deep cuts to social services. Under his leadership, funding for drug checking services, like what the Trimbos Institute does, has been slashed, and they have a 20% budget cut looming by 2026. But after a bunch of disagreements, the Dutch government collapsed in June this year, and they just had elections, and Wilders is no longer the leader. And even with all this pushback and backlash, the Dutch still really do maintain a pretty robust harm reduction infrastructure with things like drug checking services, and the U.S. just doesn't. In July, the same month Michelle died, President Trump signed an executive order that cut funding for harm reduction and encouraged states to criminalize homelessness. Danny Sims in Birmingham says that she's worried about what will happen when their already limited resources get cut even further.
That's the hard part, thinking like what happens next time? What happens for the next Michelle?
So it sounds like while harm reduction can't prevent every overdose, things like drug checking can help keep people like Michelle alive so she could get treatment.
That's exactly it, Elise. But instead of that, she died alone in her wheelchair in a parking lot in Birmingham, Alabama.
That was public health reporter Drew Hawkins. Drew, thanks so much for walking us through these two different approaches.
Thanks for having me, Elise.
And now it's time for Gulf States Gems, a series that shines a light on some of the treasures of the region. Like last week, we're highlighting organizations in our region who serve food insecure residents. Regardless of what's going on with SNAP, lots of people can use our support. And joining me now is our community engagement producer, Nellie Beckett. Hi, Nellie.
Hi, Elise.
Alrighty, so who is your gem this week?
So this week, I'd like to highlight the Heart of Alabama Food Bank, which former community engagement reporter Maya Miller covered last year as part of our America Amplified reporting project in Alabama's newly created District 2. The Heart of Alabama Food Bank, based out of Montgomery, covers 35 counties, and it distributes about 30 million pounds of food every year. Mobile food pantries and pop-ups, like the one we visited at Shiloh Baptist Church in Lounsboro, help remote regions like Alabama's Black Belt meet hunger needs.
Right, that's awesome. Thank you, Nellie. And you can see more Gulf States Gems from across the region on our Instagram. We'd love to hear about organizations doing work to fight hunger and food insecurity in Alabama, Mississippi, and Louisiana. You can send us your suggestions by emailing connect@gulfstatesnewsroom.org. This week's show is cooked up by the Gulf States Newsroom team. Our theme music is by DJ Supreme, and special thanks to our partner stations at WBHM, Mississippi Public Broadcasting, WWNO, and WRKF. You can find us in your podcast feeds every Friday. Look us up and be sure to subscribe. Again, I'm your host, Elise Gregg. Thanks for listening, and don't forget to stir your brew.